Come in.
Hi, how are you?
I'm good. How are you?
Great. My name is Mandy and I'll be your nurse today. What's your name?
Nisha.
Nisha. Okay, Nisha. So what brings you in today?
I've been having a sore throat for a couple of days, on and off.
Okay, so for a couple of days on and off.
Mhm.
Okay, any other symptoms?
No.
Okay, no dripping in the back of your throat. Nothing like that. Runny nose, just a little sore throat?
Yep.
Okay. So I'm going to start with the physical assessment of your head, neck, and face.
Okay.
Are you comfortable?
Yes.
Okay. Okay, if you can turn the chair around for me.
Sure.
I'm going to be checking your scalp and your cranium for any lesions or any abrasions. Make sure I don't see any or feel any.
Okay.
Oh, you have such thick and pretty hair.
Thank you.
Okay, I didn't feel or see any abrasions or lesions.
Okay.
And now I'm going to check in the front. I'm checking your temporal arteries.
All right.
Okay, they're good. I feel the pulse. And I'm going to go down here and I'm going to be checking your temporomandibular joint.
Okay.
Can you open your mouth for me? Close, open, close. While you were doing that, I felt the joint move, which is a good sign.
Okay.
Now I'm going to be checking your maxillary sinuses right here. Did you feel any pain or discomfort?
No.
Okay, now I'm going to be checking your frontal sinuses. Any pain or discomfort there?
No.
All right, great. Now I'm going to be palpating your face for any swelling or edema.
Feels good.
Okay, I didn't notice any, and also your ears, any swelling, any lesions. Okay, that looks great. Now I'm going to be checking for the symmetry of your face and your facial expressions as well. So let's start with the facial expressions first. Can you smile for me? Good. Frown. Good. Raise your eyebrows. Perfect. While you were doing all that, your lips were symmetrical and your eyes were both symmetrical at the same time.
It's good news.
And also your face and body and your neck are all proportionate, which is great.
Yep.
And I also checked for involuntary movements when I came into the room. I didn't notice any twitching or any treads, so that's another good sign. Okay, now I'm going to be checking your neck. If you can lift. Alright, I'm just checking your neck to make sure both sides are symmetrical.
Okay.
And also to make sure that it's erect. And it does look correct in both of the sides. The muscles are symmetrical, which is good. Okay, now I will be checking for your range of motion. Can you touch your chin to your chest?
Oh.
Good. Okay, now I want you to touch your right ear to your shoulder, and don't move your shoulder.
No.
Just your ear. Good. Now the other side. Good. And now if you can just make a round circle for me. Good. And the other side. All right, that's great. And also, can you move your head back? Forward? All right, perfect. That's great. Did you have any pain?
No.
No. And I also didn't see any hesitation while you were making the movements, which is good. Okay, now I'm going to be checking your lymph nodes. And first, I'm going to be palpating.
All right.
You can keep your head straight. Your occipital nodes, which are at the base of your skull. So I'm going in circular motions with 3 of my fingers and checking for any swelling, any enlargement of the lymph nodes. Okay, I didn't feel any. Now I'm going to go behind the ear, which is your post-auricular nodes, over the mastoid process. Feel for nodes there. Now I'm going to feel for your pre-auricular nodes in the front of the ear.
Okay.
Okay, I didn't feel any. And I'm going to go down right here, feeling for lymph nodes. And your submandibular joints. Nodes, I'm sorry. Okay, I didn't feel any there. Now I'm going to check the lymph nodes on your neck. So I'm going to check the anterior side first.
Okay.
I'm touching very slightly, but at the same time applying pressure so I can feel them. Okay, now I'm going to go in the posterior to feel for your lymph nodes. I do feel a little swollen here, just very mild in the lymph node. And that might be where your sore throat is coming from. Okay, and I'm also going to check the subclavicle nodes, which is right above the clavicle. Alright, great. Now I'm going to check your trachea, which is right in the midline of the neck. If you can lift your head. Thank you. Alright, that's your trachea. Good. Now I'm going to check your thyroid gland, and I'm going to go behind you. Actually, let me move your chair. This way is better. Okay. Just going to move your pretty hair. And I'm going to put my hands on the sides of your neck. And I feel here's your trachea just next to it. Rest them there. And if I can have you move your head down and then move it a little bit to your right. Alright, perfect. And can you swallow for me? Great. Okay, I felt your thyroid gland. I didn't feel any swelling or I didn't feel any enlargements.
Okay.
Which would show, it can show us if there's any signs of thyroid problems, if it's hyperactive, or if you're deficient in iodine, that would cause you to have a goiter, which you will be able to feel your lymph nodes. It would become very swollen. Okay, and next, the last thing I'm going to do is check for listen to your arteries here to make sure you don't have a bruit, which if there's any change in the flow of the blood, any turbulence, I would be able to hear it. Okay? Just relax for me. Okay, both of the sides were both symmetrical and the sounds were flowing. There was no turbulence or anything like that. So that is the end of our assessment, and I'm going to go ahead and let the doctor know what I found in the assessment, and he'll be in the room to evaluate you as well and give you further treatment.
Thank you so much.
Okay, thank you. Very nice meeting you.
You too.
Take care.
Bye.